Another challenge in CNS drug development is the placebo effect, and that would also be addressed in a specific part of the project. We integrate our way of working so that all partners will perform experimental assessments in exactly the same way. And protocols are aligned across all activities, from animals to patients. All data will be integrated into a common database, and we have set up a training center for advanced clinical examinations, which all investigators need to go through to be eligible to participate in the patient studies, and this is to ensure high quality. And part of the project output will be to develop common consensus guidelines for both human and animal models. This is really the first time that so many partners from academia, SMEs, and FPA members have collaborated. We're 20 partners, and there's more than 100 scientists working together from 8 different European countries. And when I did a countdown of the different study activities, I stopped counting at 65. And I think that's quite a lot of activities to actually synchronize and align to point in the same direction at the very end. So sharing knowledge, resources, and time will benefit the EUROPAIN partners and the pain patients of Europe. So this is just an illustration that would show you that we do integrate both the animal data and human data, and information will flow from biomarkers from animal studies, human studies, and techniques will be applied across species. What will be the outcome? Well, we will have identified factors that will predict chronic pain, and also some important mechanism behind chronic pain. We are aiming at better prediction when we come into clinical studies with drugs. And this will improve drug development by actually addressing, we will have done this by addressing the most relevant mechanisms. And this will reduce cost for society and reduce suffering for the individual. The expected benefits to patients would be actually then, of course, to improve success in bridging bringing new and better treatments, and to make people be able to go out and have worthy lives and going back to working life, because many of our patients are on constant sick leave or disemployed because of their pain conditions. It will also be possible to identify individuals who are at risk in order to intensify treatment, and patients that are not at risk who don't have to be exposed to drug to the same extent. And this, of course, together, the improved success rate will give FPA members and biotech SMEs better treatment options. Shortened development times will bring benefits to patients sooner. What's in it for Europe? Well, better pain treatment will reduce the socioeconomic burden for patients and society. As you're well aware, psychiatric diseases and pain are the 2 most costly health issues in Europe today. An improved success rate in drug development will give FPA members and SMEs better possibility to contribute also to the economic growth in Europe. So what's the added value in doing this in a consortium the way we are doing it? Well, we all openly share data, we share knowledge, we share techniques, we visit each other, we check that we actually do things in the same way, we exchange experiences, and I think we have all so far, even though it's been a fairly short time, have actually learned things. All results will be shared in a large database, and FPA partners will contribute specifically with knowledge in study design, and database handling, and trial performance, while academic and FPA partners will join in performing the scientific work where academia has the tradition of being in the forefront of the scientific endeavors. The SME, we have one SME in our project, will contribute with a specific and very advanced methodology for for measuring nerve activity in specific pain nerves. What have we done so far? We have employed our postdoc. It's a quite lengthy procedure. The common database is set up and working, so we will be able to pursue in the rest of the study activities. The data mining is ongoing from the old, from all the old databases within the pharmaceutical companies. We are contributing data to analyze for anything's coming up or to find what were the caveats. Our study protocols are getting ready. All investigators have undergone the same education and are certified. Even some of the sub-studies have actually started, and the first very preliminary results will be coming in soon. The financing for this project is 6 million euros from the IMI, from FPA partners 12.5 million euros, so in total it's 18.5 million euros over these 5 years. The project was officially started October 1st, but activities basically started at the turn of the year, and the activities will end then by last of September 2014. We have 7 pharma partners, a large number of academia partners, of which King's College London is the leader of the academic side of the consortium. Boehringer Ingelheim is the FPA co-coordinator, and King's College have both the academic coordinator and co-coordinator. The SMA we have in this consortium is the Neurosciences Technologies of Barcelona. And any further information of around the project, we're happy to give you any information and contact details for whoever is the most or the best one to answer to your questions. So thank you very much for your attention.
Thank you very much, Märta, and we are open for questions. Some question? Maybe I have a question. I think what seems to me very important is the importance of being able to share data, and the fact that both in your project, I mean, you have a very clear line about this has been a clear first step to set up all the logistic, how to do this, and I think people maybe don't realize how much work is already to be able to do it, and maybe you can have a quick comment about this.
Yes, yeah, I mean, it's really a large effort. From a practical point of view, we have the database. It's a virtual database, so part of it is in Germany and part of it is in UK. But when you set it up, you have to have it. It has to be possible to enter all the data in it, so that means that you have to have the same terminology for every assessment or measurement. It has to have the same terminology all over, and you have to. There's things like we're 8 countries. You need to translate all patient-reported outcomes, all questionnaires, all protocols. Everything has to be available in English and the respective languages. So that is a fantastic effort, actually. And then you need to put it up in a database where you enter the things in a very similar way. So and both for animals and for humans. So it's really been a great effort from the people who've been setting this up.